Hi everyone, Dr. Sadaf Qureshi here, and today we are going to talk about temporal fossa. If we look at the diagram, the colored area in the diagram is showing temporal fossa. So what basically is temporal fossa? Temporal fossa is shallow depression that is present on the side of skull located above the zygomatic arch and below the superior temporal line. It houses the temporalis muscles that is important for chewing and other jaw movements. Now we'll talk about the boundaries of temporal fossa. For the boundaries of temporal fossa, we have superior boundary, we have inferior boundary, posterior boundary, anterior boundary, lateral boundary, and medial boundary. Now we'll discuss about each of the boundary one by one, starting with the superior boundary. The superior boundary of temporal fossa is made of superior temporal line. Talking about the inferior boundary of temporal fossa is made up of zygomatic arch and infratemporal crest of the greater wing of sphenoid bone. These two structures made the inferior boundary of the temporal fossa. The next boundary of temporal fossa is posterior boundary. Posterior boundary of temporal fossa is by the superior temporal line. This thing is important that superior and posterior boundary of temporal fossa is by the superior temporal line. Then we have anterior boundary of temporal fossa. The anterior boundary of temporal fossa is by zygomatic process of frontal bone and the frontal process of zygomatic bone. Both of these bone processes combine to form the anterior boundary of temporal fossa. Now we will talk about the lateral boundary of temporal fossa. Lateral boundary of temporal fossa is by layer of fascia known as the temporal fascia. It extends from the superior temporal line. That temporal fascia extends from the superior temporal line till the zygomatic arch. It covers the temporalis muscles in the temporal region of the skull. Now we will talk about the medial boundary of temporal fossa. Medial boundary of temporal fossa is basically made up of four bones. The first bone contributing to medial boundary is frontal bone. Second bone contributing to medial boundary is parietal bone. Third bone contributing to the medial boundary is sphenoid bone. And the fourth bone contributing to the medial boundary is temporal bone. These four bones form the medial boundary of temporal fossa. And there is another important structure that is pterion that is also present in temporal fossa. So this was all about the boundaries of the temporal fossa. Now we will move forward to the contents of temporal fossa. That what are the contents or what are the important structures present in the temporal fossa. The contents of temporal fossa are categorized into the three categories. First are the muscles, the second category is vessels, and the third category is nerves. Talking about the muscles that are present in the temporal fossa are temporalis muscles. This is the only muscle that is present in the temporal fossa. It helps in chewing and other jaw movements of mandible. Then we have another content that is contents that are the vessels in the temporal fossa. Vessels in temporal fossa are superficial temporal artery and vein. Then we have middle temporal artery and vein, and then we have deep temporal arteries and veins. These all arteries and veins are layered in different levels, and that's why they are called superficial temporal artery and vein because they are present superficially, and then middle temporal artery and vein, and they are present below the superficial temporal artery and vein, and deep temporal artery and veins that are present below the middle temporal artery and vein. That's how they are named: superficial temporal artery and vein, middle temporal artery and vein, and deep temporal artery and vein. Then talking about the other category of content that are present in the temporal fossa, that are nerves. Nerves in temporal fossa are deep temporal nerves, zygomaticotemporal nerve, auriculotemporal nerve, and temporal branches of the facial nerve. These are the four important nerves that are present in the temporal fossa. So this was about the contents of the temporal fossa. We talked about muscles that are present in temporal fossa, vessels that are present in temporal fossa, and nerves that are present in temporal fossa. Now we will talk about the significance of temporal fossa. What are the clinical significance of temporal fossa? The clinical significance of temporal fossa involves muscle attachment, communication with infratemporal fossa, nerve and vascular pathways, and other clinical significance and pathological considerations. First, we will talk about the muscle attachment. The temporal fossa provides a site for the attachment of temporalis muscles. That muscle is used for chewing and it is considered as one of the muscles of mastication. This muscle is essential for elevating the mandible and play a critical role in chewing and speaking. The second significance of temporal fossa is communication with infratemporal fossa. The temporal fossa communicates with the infratemporal fossa. This anatomical connection allows for the passage of different important structures, including temporalis muscles, nerves, and blood vessels. The next significance of temporal fossa is nerve and vascular pathway. Several nerves and blood vessels traverse the temporal fossa. For instance, the deep temporal nerves and artery which supply the temporalis muscles pass through this area. Additionally, branches of maxillary artery, a major artery in face, are also found here. The next are the clinical significance of temporal fossa that are the temporal fossa is important in clinical medicine and dentistry because disorders involving the temporalis muscles such as temporomandibular joint disorders can cause pain and dysfunction in this area. Additionally, trauma or surgery involving the temporal fossa require careful consideration of the structure within it to avoid complication. The next significance of temporal fossa is pathological considerations. Conditions such as temporal arteritis, a form of vasculitis, can affect the temporal artery which runs through the temporal fossa. Early detection and treatment of such conditions are crucial to prevent serious complications. So this was all about the significance of temporal fossa, and this was all about the temporal fossa. Thank you so much for watching. Don't forget to like, share, subscribe and comment on our channel. And if you liked our video or if you want video on any other topic, you can also comment and we will work on it. Thank you so much for watching.